Hello, my name is Greta Jurenaite and I'm a physiatrist in a team of ISICO. And today I would like to present one interesting study we did this year, which is called Does the Brace Actually Influence Quality of Life of Our Patients? The fun fact that the study was born in a Charlotte airport in USA after an important International Congress of Scoliosis Research Society, which we presented last year in October with Professor Negrini, and we presented an interesting study how our patients managed to wear the brace full-time and had a very good result. After this presentation, few interesting and very valid questions were born, of course, and we decided that a good study would answer these questions as well. So the main mystery was actually how we managed to have such a good adherence for a full-time bracing. And in ISICO, we actually dedicate a lot of time and attention to patients' satisfaction. And we used, I would say, one of the best, at least one of the most modern braces in our field. So we thought maybe this could be the key factor of the adherence of our patients. So we analyzed almost 1,600 patients, more than 1,600 patients, and we divided them into two groups. All the patients had adolescent idiopathic scoliosis. One group came to us from another facilities using another braces different than we use, and the second group was patients who just starting their brace therapy, so they had a new brace. We also evaluated all the braces that our patient had from other facilities, and we evaluated symmetry, comfort, and visibility under closes. So in other visits, especially at the first visit, we always give them to fill two main questionnaires that we use for quality of life, which is SRS-22 and ISICO. So we came for the first visit with an old brace or just starting the new brace treatment, and we prescribed for all these patients the same brace, the push-up brace that they use in ISICO, which is quite symmetric and very minimal visible under the closes, and we just let them live with these new braces for 4 months. After 4 months, we did a follow-up visit, and we retake all the measurements as for a usual follow-up visit, and then we ask them to refill again the same two quality of life questionnaires. So what was the result after 4 months of living with the new brace? And we saw that one thing was the most important, the patient's satisfaction, that was clinical significant important, and the quality of life, the general quality of life, actually depended from various other factors, as a lot of things in life, yeah? And it depended mostly on wearing hours of the brace, which is very important, a therapeutic environment, and an overall treatment experience. So in conclusion, we can't really say that only one thing as the brace quality, the most modern brace, changes the quality of life of our patients, but an overall experience that we are talking about, which we have in mind. The environment, the team that we have, and also the overall experience of the therapy. So we all need to try to give what we have the best, even if that would be the better brace, more attention, more kindness to our patients, so that could change the quality of life of our patients and not just only one thing.